So I want to welcome back Dr. Filidei.
Thanks for having me.
Yeah, your last two videos did amazing. We did mold and we did a couple of other videos and they just did so well. So I wanted to have you come back and talk about something we see all the time at Amen clinics, more than people would think. Lyme disease.
Right.
So people are usually surprised when I say that Lyme disease causes a lot of trouble with the brain. But tell us a little bit about what you see with Lyme. When people come to the clinics, we test for Lyme and sometimes they're surprised. So why do we do that and what do you see?
Right. So again, one of the main benefits for me as a functional medicine doctor working here is the scans. The scans can really show toxicity patterns. And so if I see a toxic brain, I have to figure out why that is.
Right.
And infections are always way up on the list.
Right.
Now, Lyme disease is thought to be, you can only be in New England or Virginia to have Lyme.
Yeah, it's a myth.
It's literally in every state.
Right.
California has Lyme. Berkeley did a study where they found 60% of the finches in Berkeley have Lyme. 20% of the ticks on the birds in Berkeley have Lyme. Stanford did a study of 12 state parks in the Bay Area, San Francisco area. 3% of the ticks have Lyme. And 60% of them have one that doesn't even show up on the tests.
Oh,
it's
boy.
called Borrelia miyamotoi.
Right.
So Borrelia is the spirochete that causes Lyme disease.
Okay.
So you don't have to be hiking out in the wilderness in Virginia to be exposed.
No, and I know Yosemite is known to have problems with Lyme as well. I don't know what the percentage is. I have no idea. But one of my favorite stories from Amen clinics was we had a young girl, high school aged, who went on a camping trip with her family. They were at Yosemite, and they had this magical moment. They were surrounded by deer, and they just thought it was this amazing moment. They get home, and a couple weeks later, the daughter, who was in 9th grade, I think she was in 9th grade at the time, 9th or 10th, she starts having hallucinations. She begins to hallucinate. She's having all sorts of problems. They take her to the doctor. She's put on antipsychotic medications at that age, which is really hard. I mean, those are really some harsh medicines. And she begins to get worse and worse and worse rather than better, and they end up institutionalizing her. So finally, after a tremendous amount of money, a lot of heartache. She has, she's not going to high school. She's in an institution. They finally are like, this is enough. And they bring her here, which is usually how it happens, right? They fail a bunch of other...
Absolutely. No one's thinking about it.
Right. They fail a bunch of other treatment. They end up coming here. They get a brain scan. And the first thing that was said was, wow, her brain is toxic. Why is her brain so toxic? So she's tested and Lyme is what came up. She was put on antibiotics, not antipsychotics, antibiotics.
Right.
And our next photo of her is of her graduating from college. So we get a photo of her graduating from high school. She's graduating from college. She ends up living a normal life. So sometimes your brain issues are not because you're psychotic. You have to ask why. And I love that story.
And Lyme is always one of those. Also, so that same kind of story can happen with other infections. It can happen with almost any kind of infection. So there's something called pandas. I think we might have talked about that one. So any kind of infection, that one is strep that can cause almost the exact same type of thing, overnight psychosis, OCD, bipolar, and they get hospitalized and they get drugged for years, and it was an infection. So Lyme in particular is a real stealthy one because it's an ancient organism. It's been around for millions of years. They find Lyme Borrelia in amber from dinosaur times.
Oh, wow.
It's a really smart bug. It has 3 times more DNA than any other bacteria. So it's smart, it's stealthy, it knows how to hide. And you don't have to get it from a tick. It's not just ticks.
Oh.
So any insect that bites you and sucks your blood
I did not know
can
that.
carry Borrelia.
Oh, that's a myth. So
That's a myth
the other
as
thing
well.
is I heard a few years ago, I heard that it's now discovered that it's sexually transmitted as well.
Yeah, we try not to say that much, but it's definitely possible. It's in saliva, it's in vaginal fluid, it's in breast milk, it's in semen. Can you transmit it that way? It certainly stands to reason. There are some caveats. It turns out that the tick saliva is really important for transmitting the disease and making it worse.
Okay.
So the thing with ticks, people think, oh, I never had a tick on me, but we're not talking about dog ticks. We're not talking about the big fat ones. These are tiny. They're deer ticks.
But you do get the bullseye rash, correct?
Yes and no, right? So
what do you mean yes and no?
A lot of people with documented Lyme never saw a rash.
Oh, dear.
Yeah, probably less than half. people get the rash.
Oh my gosh.
And it doesn't need to be a target either. If you get this, it literally looks like target, spot in the middle and circle around it. That's almost assuredly Lyme. However, some people just get a little round rash or an oval rash. There's no target, or they don't get a rash at all. And they still had a tick bite and they get Lyme.
So that's just definitive if you see that, but it doesn't mean you will necessarily have that.
Correct.
And you could still have Lyme.
Absolutely.
So I have a couple questions. One, why are most general practitioners that are Western trained so adamantly against testing for Lyme? That's one question. And the second question is, is there such, I've always heard, at least maybe I'm wrong on this, but why is there such a high false negative?
Right. So good. We could use a couple hours on this topic because there's all kinds of issues with testing.
Is that why doctors are so resistant?
They're resistant, number one, because unless you live in an endemic area, you can't have it. Unless you had a tick bite with a target lesion, you can't have it.
But we know that's a myth.
Completely wrong.
Right. We know it's a myth.
And a lot of people have what they think are spider bites. Right. Spiders don't bite people much at all. They can't. They don't even have teeth to do that. Or jaws. Some do, there's brown recluse and black widows, but most spider bites are probably some other arthropod.
Well, and when you have a spider bite, it's usually 2 spots, correct? Usually it's like 2 small spots.
If you can even see that.
Right.
Right.
But typically if you have one, it's like 2. It's not
and
one.
Those are pretty big spiders, too.
Right.
Their brown recluse are pretty good size. It's not little things that just come and go. So the problem with testing, too, is they do it's called 2-tiered testing from the CDC, where they start with a screening test, which is lousy. I don't even bother with that test. It's negative. Probably more than half the people with Lyme, that test is negative. It's usually acute. If you've had it chronically, that test kind of goes away. And then the Western blot test, which is how you confirm the original one, is also very poor. It's very lab dependent. When they were deciding what bands to put in a Western blot, it's literally a bunch of bands, and each band is a different antibody to Lyme. You have to have a certain number of those positive. Well, if you have 4, but you need 5, you're negative. That's kind of silly, especially if you have a history and symptoms of Lyme. So you have to read between the lines, literally, with Lyme testing. And so testing is an issue. The whole issue of tick bite without the rash, you can't have Lyme. Where you are, symptoms can be anything. That's the big kicker with Lyme. It's called kind of the master of disguise. It can cause any symptom you could imagine, really, in mental health and physically.
Right.
It can cause pain,
joint
pain, brain problems. There's different species, too. People don't get that. Lyme disease is called Lyme because it was found in Lyme, Connecticut, a city in Connecticut. That's one species. There's 30 of them.
So is there a definitive test?
There are no definitive tests as of today. I'm always looking. There's many different types of tests. There's pros and cons to all of them.
So I had heard that sometimes some doctors will do 3 tests, and if like a certain percentage of it is positive, and you've got the symptoms, that's how you sort of decide. Is that what you do?
So Lyme is always a clinical diagnosis.
Okay.
So even if somebody comes in and they have a frankly no argument positive test, it doesn't mean you have Lyme disease still. Because you can be, if it's sexually transmitted, we do test couples, and let's say one person is really sick and the other is totally asymptomatic, but they're positive. Does that mean they have Lyme disease? No, it doesn't. They have a positive test. They may have been exposed, but they're not sick. So it's always clinical. We always have to fit it to the person and the symptoms.
Right.
Now, one problem with that is Lyme can do almost anything.
Right.
So if you have a brain problem, a physical problem, it can be Lyme.
Okay.
Now,
so it's complicated.
Yeah, it's complicated, and I do have to put a little caveat in there, too. There's a lot of, quote, chronic Lyme patients that aren't chronic Lyme patients.
Okay, so maybe this is now I'm starting to see something. Maybe this is why so many Western trained doctors are like, oh, here we go again.
Yes.
So it's kind of like the old fibromyalgia argument, which we know is a real thing, but a lot of people
Lyme can cause.
Right, but a lot of people were using it as like that catch-all phrase, as opposed to when someone really has it and knowing how to sort of identify it and treat it.
Right.
Correct.
So, because chronic Lyme patients can be chronic viral patients, or chronic mold patients, or chronic fungal
or like
patients.
Epstein-Barr maybe.
Exactly.
Right.
So
which is a real thing.
They're all real, and then you could have all of them. And
Right.
it could be one is doing one thing. So you really have, what I tell all my patients with any kind of chronic illness is, you have to get better, you have to clear the runway to be able to take off. If you have viruses in the way, you're not going to get better. If you have a lousy diet, you're probably not going to get better. If you have metals, you won't get better, especially with Lyme. So,
well, that's what we talk about: biological, psychological, social, and spiritual circles. You got to sort of go after all of them.
It's the whole picture.
Right. So I talk to a lot of people, and because I know what we do, I'm like, I try to get into that Lyme discussion, and then I'm like, I back off because I'm like, it's so complicated. I don't know where to start. So I send them to you.
It's the Alice in Wonderland rabbit hole.
It really is a rabbit hole.
Yeah.
So that's why I think it's so important, as you can see, because even if someone thinks they have Lyme or they aren't sure, they might not. So that might be something else entirely.
Correct.
Or they've been told by someone who doesn't specialize in Lyme that it's Lyme. It could be something else entirely. Or you've been told that you don't have Lyme. It could be Lyme. So you really do need someone who specializes in it. You specialize it here at this clinic. We have someone who specializes in Lyme on our East Coast clinic in Virginia. Right. So because it's a really big topic. So we see a lot of what we see is toxicity in brains, and the first thing we start thinking is, why? Is it mold? Is it Lyme? Is it? We don't know. So we want to know.
Correct.
So we don't assume you are psychotic. This is the point.
Yeah, and a big thing too is always, I bring this up every time, is when did things start? So were you just this way from birth, or did you get that way later? And if so, when was that? And what happened around that time or shortly before?
Right.
Oh, I did go on a hike, 3 weeks before I had a problem. I've never been the same since I had the flu. So all those things you got to fit into the picture.
Right.
And again, Lyme is always one of those. But, I've had many patients that come to me with chronic Lyme. They've been on antibiotics for years, and no one cleared the runway. They have way too many metals, or they live in a moldy house. So you're not going to get better unless the whole picture is taken into account.
So if you suspect you have Lyme, or you have been told you have Lyme and you don't really think you do and you're not sure, we would suggest you actually see someone who knows, who's been trained in dealing with Lyme, and you have actually been trained in dealing with Lyme specifically.
Yeah, a member of ILADS, which is the big Lyme literate doctors group, right?
Right. Mm-hmm. So, because it actually is sort of a subspecialty, but it is a...
You have to get extra training.
You need extra training to know what you're doing with it. Right. So we at Amen Clinics do actually, because we see so much trouble with infections and brain toxicity, we do have doctors who are trained with it. So if you need help, reach out to us. You can call the number at the bottom of the screen. This is Dr. Filidei, Mark Filidei. He's at our Costa Mesa clinic. We do have doctors in the East Coast clinics as well. How do you know if you don't look? How do you know if you don't check? So thank you for helping us clear that up.
Glad to help.
Appreciate it.